Oh, there you go.
Good morning.
Cut hay again, or did you get it up, or?
What's that?
Cut hay again yet, or you're saying you gotta cut that stuff pretty short, huh?
Well, I cut,
You guys got rain.
first cutting alfalfa's all done. I cut yesterday. Saturday and I started and then I finished cutting grass and meadows and I got a 5-acre chunk of alfalfa I took out. We'll see what the weather does now.
You guys have been getting rain, it's been going right around Piers, we've got nothing.
I know, my phone's been ringing from guys over by you and,
Yeah.
cause they know I got feed left, so. Corn was damn near knee high
Yeah.
and they burnt it right off the ground. He said, you guys go out there now, it's looking nubbies.
The Morrison County Board of Commissioners meeting will come to order. Please stand and join us in saying of the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, Mr. Chair.
Good morning, everybody. Approval of the board minutes.
Mr. Chair, I'll make that motion.
Motion made by Commissioner Jelinski,
Second?
second by Commissioner Wilson. Any discussion? All in favor?
Aye.
Opposed? Motion carried. Additions or deletions? Gentlemen, can I get a motion for the agenda?
So move.
Motion made by Commissioner Wilson. Second by Commissioner Jelinski. Any discussion? All in favor?
Aye.
Aye.
Opposed? Motion carried. First on the agenda this morning is Camp Ripley Community Brief. Welcome, General.
Hey, good morning.
Morning, General.
Ladies. Thank you for having me, and excited to be here in front of you again. It's been a couple months since I came and talked to you, so. Today, though, we're doing what we normally would do in April or May, which we try to get ahead of in the spring when we're not so busy, and just like you all, COVID has impacted our ability to get out and do things as well. And so now I'm happy to be here and give you our yearly update with the year half done. But we'll quickly go through this and open it up for any questions and try to have a conversation. So the second slide you're seeing there is my mission statement on Camp Ripley, and it's truly twofold. It's to provide the best training resources for our soldiers and our state agencies. And that's, so that they can respond to our nation's worst day or your state's worst day. And we're pretty proud of the response we had a month ago in one of your state's worst days down in Minneapolis. And Camp Ripley was integral in that response. We had 3 battalions that were training there on that Saturday morning when we got the call about, it was actually Friday night, about 12 o'clock. Those kids worked all night long to get down to Minneapolis. And the logistics support behind that train followed, and that all came from Camp Ripley. So pretty proud of that organization and what they did. The other tier of that 3-legged stool is fostering positive community relationships, and that's the heart of why I'm here today, is to continue the relationship that I have with the community. We've seen a lot of different township boards and community organizations over the last month, and that's truly just to enlist your help and help and explain to the community what Camp Ripley is and what it does and why it's important in your community. So next slide, please. So the next 3 slides talk about the leadership at various levels in the Minnesota National Guard. I want to throw this up there because it seems like we change seats every year, and we've got more change on the horizon. General John Jensen is my adjutant general. He's my boss. He's just taken a job to be the head of the Army National Guard in Washington, D.C. So he's waiting for Senate confirmation this week, and he anticipates after the 4th of July that he'll be moving to D.C. to become the director of the Army National Guard. Now that'll come with a promotion for him to 3-star, and it comes with a vacancy here in Minnesota for the adjutant general position. No, I don't intend to try to apply for that. Actually, I think we have some great candidates that have applied. The governor's application process ended on Sunday. So I'm hoping that by 2 weeks here, we'll know who will replace John Jensen. And if you had a chance to watch any of the governor's civil disturbance press conferences, you saw what a phenomenal leader John Jensen is in his ability to provide the best advice to Governor Walz. And assisting General Jensen is his CSM. He's a new individual as well. He's originally from the Fargo-Moorhead area, worked a lot in Washington, D.C., and came back to be our senior enlisted advisor, and his name is Brian Soper. Next slide. We changed the leadership in the division headquarters a little bit as well. My good friend Mike Wickman, who I deployed with in 2004 as a major, is now the division commander. He'll soon get his second star and become a major general. And working for him as CSM Mike Whitehead. Mike's got a job outside of the Guard as well. He's the national president of the Disabled American Veterans. So we've got a lot of connectivity at all levels of government, and that really, continues to make the National Guard pretty strong. The next slide, please. I'm probably the most consistent face here. This is my 3rd year as the senior commander at Camp Ripley, and thoroughly have the best job in the Army, and I'd hate to leave it in reality. This summer, we switched over my M-Day, or my traditional guardsman, who is my garrison commander. Brian Melton was deployed. He came back and 2 months later retired. And Colonel Josh Seimer became the new garrison commander. And working for both of us is CSM Marcus Erickson. Matt Erickson was my previous CSM. So we just changed a few letters in the first name, and we got a new one. And Marcus brings a wealth of experience. He's been a CSM for about half as long as he's been in the Guard, I think, but he's a retired highway patrolman, recovering farmer from Austin, Minnesota, and he and his wife have now become the other 2 permanent residents on the installation, so I now have neighbors, and so it's a completely new game having another family on Camp Ripley, but it's kind of fun. So next slide. Obviously, the heart of why we come here is to tell you about one of the things is the economic impact of the installation. You'll see it was down a little bit compared to 2018, but it still hovers around that $260 million of total impact, about $120 million of direct wages and contracts. Obviously, that number ebbs and flows year to year, and it's really tied, as I've talked before, to the construction projects we have on the installation. We finished up the $31 million worth of recovery from the 2016 tornado. And so those projects, we all took the keys to the buildings from in 2019 and 2018. And so we've got a little less construction on the installation. We're still building stuff. So if you go there, you'll probably find 5, 6 construction projects in place. They're just a little lower cost. Next slide. Some of our highlights for 2019. Our man days didn't change at all, even though our Armor Brigade combat team spent 3 weeks at Fort Hood, Texas, instead of Camp Ripley for annual training. We still hovered around that 400,000 man days. Plus, we added another 17,000 man days of civilians training on our installation, so we continue to add state agency partners and local civil government agencies that are coming to Camp Ripley and see it as a valuable place to hold conferences and meetings and trainings with the housing facilities we have and the great classrooms. So we continue to market that a little bit. I think our numbers for next year will be down a little bit with the COVID piece, because we've had a lot of people cancel the last 3 months and throughout the summer. Our conservation program, we'll talk about it a little later in another slide, but once again, they won another award at the DOD level. Last summer, while the 1st Brigade was in Fort Hood, Texas, the 2nd Brigade out of Iowa came to Camp Ripley and held their XCTC, their 3-week-long training exercise. And they brought almost 3,000 soldiers from Iowa. And they also brought Lieutenant General James, who's the commander of 1st Army, to come and watch their training. And I had the opportunity to host him at my house and talk to him about what a great installation Camp Ripley is. This winter, we made a little more noise than normal, but our Armor Brigade combat team is loading trains right now to go to the National Training Center. So part of their pre-training, or their training before they could go, was to do all their gunnery that they normally do in the summer, and they did all that gunnery in January and February. So we learned how to slide tanks and Bradleys around corners on ice, and what we needed to do, I guess, to help those units be successful in the winter. We hosted a couple of congressmen, both Dean Phillips and Pete Stauber, on the installation with big tours, showing them what the National Guard is. And then finally, the last two pieces are kind of important as well. We have a regional medical warehouse at Camp Ripley. It started out as the Minnesota National Guard's medical warehouse, and it has expanded. It was just the 5-state region, and now it's got a national mission. And so what that means is almost $8 million of federal money comes into that warehouse, and they purchase medical supplies for all the state's National Guards. And so they're able to then put in orders, and those orders are shipped to the state to replenish their medical supplies. And so pretty cool asset to have in Minnesota, and gives us a lot of emergency capability. So during the pandemic here, that warehouse was very important as well. And you know, so with that, we expanded the staff because they went from being regional to 50 states and 4 territories. So they've probably got about 30 people working in that warehouse right now. So great news story there. And then finally, my fire department received 3 brand new fire trucks. We moved them into a new fire hall, which you'll see a picture of later. The chairman will probably tell you how cool it is to look at that line of red steel in there. But more importantly, they responded to over 225 times off the installation. And that's through the joint powers agreement that we have between the Morrison County Fire and Emergency Services and Camp Ripley. The majority of those calls were part of their Gold Cross ambulance service piece. We host a Gold Cross ambulance on the installation. It's now a Mayo ambulance. I don't know if it's called Gold Cross anymore. But that ambulance crew, when Mayo needs a second ambulance in your county, it comes from Camp Ripley, and those firefighters go on off the state dime and go on Mayo's dime and hop in, and they're responding. And a lot of times they're responding before either the Little Falls Fire Department or the other ambulances can get there. So great kudos to that team. But more importantly, for your residents around Fort Ripley and that, it hopefully is gonna save them a little money in insurance, because now there is a fire department that can respond up there within the distance required. Next slide. Like everybody in the county and nation, we've been fighting this insipid virus called COVID. For us, it resulted in a lot of people learning that they could do their work from home, even guardsmen. So we've spent 3 months doing what we call distributed guard drill, where we're allowing soldiers to stay at home. We're paying them for their time for that weekend like they normally do. They get a laundry list of things they have to accomplish, either online or individually. And leaders have learned new ways to communicate with their soldiers and bring them into Zoom meetings while they're doing PT and things like that, so that they can actually look everybody in the eye and say they did what they're supposed to do. Along with that, on the installation, we've instituted a lot of disinfecting. Our facilities, we basically have cut in half their capacities so we can social distance our soldiers. We're being very successful right now in units that do pre-AT testing. So for instance, our second of the 135 infantry, they came for essentially 3 weeks on Camp Ripley, and starting the end of May, they tested all their soldiers in the front end, which allowed them to identify the 3 positives they had and isolate them. And they were basically clean and successful then for the next 3 weeks in their training. Today, a battalion of infantry from Iowa leaves Camp Ripley, and they're the opposite example of that. They didn't pre-test, and so halfway through their 2-week AT, they started transporting soldiers to St. Gabe's to get tested, and in the end, they had over 58 soldiers they tested, and they had 13 positives. So those soldiers that were positive, as well as the soldiers that came in contact with them, were immediately evacuated back to Iowa, so they didn't stick around in my installation too long. But I think that's something that we're gonna deal with until we get a vaccine for the virus. You know, we're gonna have that situation on the installation. To support that, we have set up an SOP for an isolation support facility. So if we so choose, we can quarantine or isolate soldiers in that facility for up to 14+ days, and we've got a SOP on how we'd feed and house them and take care of them and isolate them from other soldiers so they don't infect anybody. And we think we got the capacity to handle about 400 soldiers in there if we had to. Our 1st Armor Brigade is starting their movement to the National Training Center, and part of their requirement is 4 days before they get on a plane or a bus to go to California, they have to be COVID tested. So all that COVID testing is gonna occur at Camp Ripley. So that 5,000 soldiers that would have normally left from, you know, Mankato and Moorhead and Duluth from their local armories, they all have to funnel through Camp Ripley to get tested, get held there for 3 days, and then move on. And the positives will be isolated there for a period of time, and then we'll decide if we're gonna send them home or if they'll stay there until they're done with their quarantine, and then they'll join their brethren in California. And so, pretty busy time over the next month for us as that brigade gets from Minnesota to California and then gets back. They all have to be COVID tested on the backside too, so we're not sending soldiers that are concerned about bringing a virus home to their families. So we're spending a lot of money, you know, trying to keep soldiers safe in this COVID environment. So, next slide. If you come on the installation, you'll see some new construction that we're actually using. The picture in the upper left there is of what we call the longhouses. They're replacing our tin huts. We've been talking about that for a couple of years, but we're finally starting to see them come out of the ground and shape up. I got 2 more to build in Area 5, and we'll be done with Area 5. We call our billeting areas, they're numbered, I guess, and so Area 5 is about a battalion-sized area, and we'll have, I think 9 of those style of buildings there on the left, and each one holds about 50 soldiers. The 2 pictures on the right are of some of the construction that we took ownership of that was the remnants of the tornado replacement. So we're calling that building in the upper right a Super T building because it's got a 2nd story above the kitchen, and then another headquarters building there on the lower right. Next slide. Some other projects that have occurred on the installation, we're highlighting the fire department a little bit. In the upper left there is their new home. You know it's their home by the red trim around the doors. In there, they've got we're working on probably a dozen fire trucks in there in reality. We've got another $2 million project that's in the works now to park another building next to that building, and that'll provide them their billets and their lounge area and kitchen and some vehicle storage. So that fire department footprint will be complete then with that building, and we hope to start construction on that yet this year. In the lower left there is a picture of some of our generators that we're parking next to our substations. We have 1 more generator set to set by our east substation, and then all my substations will have generator backup. It's natural gas backup, so it gives us some, as long as the gas pipeline works, we'll have electricity at night. And the next step of that is to buy the switching software system, the SCADA system that'll control the load, allow me then to switch off of the network or the electrical network and go completely off the grid at that point if I had to, with the solar field providing daytime power and the generators providing night power. So gives us some capability to island in that emergency piece. And then the lower right there, our PX got a complete renovation on the inside as well. And so kind of a completely new modern looking there as well. Next slide. So some of the training that we've got scheduled yet this summer, we're in the middle of June right now. We got rid of the 2 of the 135 this week. They went to Fort Bliss. So there are a lot of that military audience, but we're loading trains right now, and we've got some other activity going on. You'll see a lot of aviation in the air, and so, you know, if you talk to your consistents, the 3 months of no training really affected our pilots a lot, and so they've got a lot of time to make up to meet their normal standard of time. So our C-130s are doing a lot more flying over the installation, as well as a lot more Chinook and Black Hawk flights as well. In July, we're gonna finish the loadout of the brigade here right around the 4th of July. And then we were scheduled to have our youth camp in July, and our youth camp's been canceled due to the COVID piece right now. So July will be a little quieter, but then we'll roll into August, and the 125, or I say again, the 151 Field Artillery will be here for a couple weeks in August, so we'll produce some noise with their artillery firing. And then more importantly, in September and October, the brigade comes back from National Training Center in the end of August, and they have to roll right into a training cycle in September, because they have to do all their qualifications of their main tanks and Bradleys this fall. And then we gotta fix all that equipment, because starting in November, that equipment will all get rail loaded again, this time for their deployment to Kuwait. And so they deploy in January to Kuwait. So it's gonna be a very busy fall for the installation and in the maintenance realm, as well as in the training ranges area, as we try to keep them kids' skills sharp enough for them to deploy. Talked a little bit about the C-130s already. Obviously, you've heard me talk before, the two C-130 wings in the state come out of the St. Paul Minneapolis Airport, and they predominantly fly over Camp Ripley every day, doing touch and goes on my runway, as well as dropping pallets of supplies out of the back of their airplanes. And their ground forces use our ranges and things, no different than my Army units, but a lot more activity with them here in June and throughout the summer, just trying to catch up them flying hours that they missed in March through May. Next slide. The Camp Ripley partners that I have permanently stationed on the base continue to be the DNR and the State Patrol, as well as HSEM and MnDOT. The State Patrol had their academy starting in January. It normally runs to the end of May, but they accelerated that and graduated their officers in April, which I'm sure they were glad they had the extra manpower here in the end of May. And then the DNR is doing their academy right now. They got, I think, 14 kids that are going through their academy as we speak. They'll graduate sometime the end of August. HSEM continues to hold some courses there. They're also talking about using their training center as an alternate EOC for the Line 3 response. So I think whenever they actually get their building permits to start Line 3 construction, we'll probably see a permanent party of emergency managers there helping, trying to figure out, how to assist that public project, I guess. Then finally, MnDOT normally does its snowplow driver training, and you end up seeing a lot of snowplows in town associated with that in September and October. They've canceled their training this year just due to the COVID piece, and so hopefully we don't get a lot of snow because they'll be less trained. But I think they'll probably survive one way or the other, I guess. But we're assured that they'll come back next year and continue their training. It's not something they're abandoning, so that's a good thing. Next slide. We've done a lot of community outreach this last year. Just to highlight the first one there, we had our open house in September. We highlighted the Air Force. We highlighted the Air Force because Charles Kapsner was putting his Air Force painting into the Veterans Cemetery. We're very proud to have the Minnesota Veterans Cemetery be next to Camp Ripley, and the public sees it as one complex. I'm excited that hopefully the museum might get a chance to move out there as well and extend that complex. We'll see what happens here in the next couple months with the bonding bill, I guess, associated with that. A lot of different school events last year, which this spring we didn't have much of, but we hope that we'll find a new normal again that allows us to teach kids about Camp Ripley and the environment. We did a good job with the food drive this year. I think our food drive brought food to the Little Falls food bank this year. And then obviously we love to highlight our veteran and our disabled veteran hunting and fishing programs. This spring we weren't able to have any of our DAV turkey hunts because we didn't want to put that threatened population together at Camp Ripley and maybe expose them. Same way with our fishing event that we normally hold in June. We're hoping to postpone that and maybe do a fall event, and we'll make a decision on that here in July sometime. Next slide. Our environmental program, as I alluded to in the beginning, remains award-winning. This year, again, they won the Natural Resources Conservation Award at the DOD level. You see that they won it in 2017. I think they'd win it every year if they could apply every year. But they find some other, area to apply in the off year, I guess. But, we're super proud of that program, and obviously super proud that at the DoD level, they're competing against every base in the Air Force, Navy, Coast Guard, Army, Marines, and they are beating them. So that's a pretty cool statement of the quality of the people we have. Obviously, our environment at Camp Ripley gives us a lot of opportunity to do environmental things as well. And so, pretty cool program. The picture on the right there is of one of the golden eagles we captured again this winter. I think we captured 2 this winter and put backpacks on them and GPS backpacks. And so, they're residents of your county in the winter. And right now in the summer, they're way up above the Arctic Circle in northern Canada. And so it's kind of fun to see their route as that little GPS transponder tracks them. So, next slide. With great environmental program, the reason why we employ those people is because we have a lot of environmental oversight as well. So you can see all the different agencies there and the people that come and inspect us. What's really cool is I'm pretty assured that I wouldn't be winning awards at the DoD level if we weren't meeting all the regulation requirements as well. And so it puts me in a level of assurance that I really don't spend a lot of time getting in the weeds with what that team's doing. And I know that they're protecting my installation from maneuver damage and from pollutants. And that's a good thing. Next slide. They wouldn't be so award-winning without all their different partnerships. And so, once again, we partnered with Bowser and the Nature Conservatory to spend a lot of money on ACUB this last year again. We continue to pump money into that easement program. We used a lot of state money as well. You'll see that in the next slide. But those 2 partnerships are pretty critical to that program. As well as our internships. Once again, we've got interns from both St. Cloud State and Central Lakes College running around on the installation. I talked to one the other day that had a whole pile of mole traps, and he was cleaning them so he could take them out in the field and catch moles to study for some reason. So I'd have a different theory of what to do with the moles when you got them, but that's why they're environmentalists. So next slide.
Yeah, really.
The prescribed burn program, Mike's probably a better resource to tell you how successful we were on that this spring, but we burned about 15,000 acres on Camp Ripley again this spring. All the stuff in yellow is stuff that we burned so that we can train without having to worry about a fire going off the installation and burning up someplace else in the county. The stuff in dark brown is stuff that we're burning just to control the vegetation or change it. And it was a great spring for us to do the burning. The weather was perfect. The spring was perfect for burning. And the only good thing I could say about COVID is there weren't any soldiers on base to interdict with their ability to burn. And so they were pretty successful at being able to pick where they wanted to burn what day. And then next slide, please. And then finally, we changed the ACUB map a little bit, but it's pretty easy to understand now. Everything in green has got an easement on it, or it's land that is similarly protected for the lifetime of the installation. And so, in 19, we pumped, to date this year in 19, overall about $42 million has been spent on the ACUB program on acreages around Camp Ripley. We're very excited about the $2.7 million that we got from state money, the Lessard Heritage Fund. That helped. We're actively acquiring some more land on the north end of the installation along the Crow Wing River there. The Sullivan Township has offered to be the caretaker of that land once it's acquired from Potlatch and the Minnesota Power. And so it's another, almost 150 acres there along our northern border that we're able to protect. And so continues to be a great program. Got a lot of people standing in line hoping that we'll have more money so that we can provide them a chance to get an easement on their land as well. Next slide. And ladies, gentlemen, that's the end of my update. A picture of my great team in front of the historic building outside of my headquarters. And I'm open myself to any of your questions, complaints, concerns, or anything I can fix.
Gentlemen,
Good information, Mr. Chair. I appreciate it.
Commissioner Blaine.
Thank you, Mr. Chair. General Cruz, there's two topics I just want to touch base with you on. One,
through work at Region 5, there was the initiative dealing with childcare at the installation, and that got handed off to the city of Little Falls. I was just wondering if you'd want to comment on that.
Yeah, so I proofread this morning the letter of support that I'm writing to go into that grant package. So the Department of Defense notified us about a month and a half ago that they had some grant monies available for construction of facilities, and childcare facilities are part of that. I handed that information off to my chief facility officer, and he came back and said, well, you know, the way we program stuff, I can't react as fast as this timeline. So we handed it off to the Region 5 folks, and they were very excited because they thought they had a project that was kind of fit inside of that. So we are actively marching towards the deadline to apply for that grant money. You know, it's a DOD level grant, so we'll see. We're trying to justify, you know, in your community, I have a little over 700 full-time employees on the installation, and 200 of them live here in Little Falls. And, you know, there's a large portion of that have children. So I think, you know, what I read in the justification letter that I'll sign is a pretty strong statement of why it's important that the Department of Defense helps us. You know, talking about the fact that Minnesota doesn't have an active duty base, so that for your soldiers, there's no place for them to go and get services like soldiers in Kansas or Texas and things like that. And so, not that people are traveling to put their kids in daycare at Fort Hood, but you know, we know that we have a need for daycare in the county and the city of Little Falls, and we know that our soldiers contribute to that demand for daycare. So I think it's a good project. I'm hoping that we haven't tied our kite too tight to the fact that we might get the money, because, you know, it's competing at the DOD level. So it's the first time we've done this, so we'll see.
I appreciate your recognition of the needs of the city of Little Falls, and certainly Morrison County, and the installation's willingness to be a partner in addressing that, I think is paramount. The other issue I just wanted to ask about, we haven't had a chance to talk about this for a while, but the addition of a rail line for loading for your installation along 371 there. Any comment on that?
So construction starts, they told me, around the 29th of June. So this next week, we should start seeing some dirt moving along the siding there. It's a 6,000 foot long siding that starts just north of the ethanol plant. And should run from, you know, it's a little over a mile, I guess. And so we hope we were hoping to get it all in place so that we could use it for the return of our rail in late August. I don't know if they're gonna be that quick with the construction. We spent, so we have a lease with Burlington Northern, and it was an old lease. It was probably 10 years old, so it was time to update it. And it took 2 months for our lawyers to agree on the language inside of that lease. So I took a month out of my construction timeline. And so it's okay. It's gonna get built, and it'll bring its benefit. You know, it was a great example yesterday of the benefit of it, right? I'm still waiting for a train to come in today. I got, you know, 300 kids standing around waiting to load a train. And just, you know, the train's delayed getting here. And if I'd had that sighting yesterday, while they were loading the train that was in base, Burlington Northern could have sighted another train there. But because of the way I currently got it, I gotta wait for that train to pull, and so now we're waiting for the train. So, but by this fall, I hope to have a sighting. We're still competing for about $14 million of federal money to put 2 spurs inside of the installation. If I get that money, I'll be able to have 2 trains in there at once.
Excellent, excellent.
Commissioner Winter?
Yeah, General Cruz, question about, since we were talking about this virus thing, what's the protocol? Because you mentioned something about where the platoon or whatever they're called from Iowa came to Minnesota. Do you guys test at the camp, and then if they test positive, you took them to St. Gabriel's, or
No.
what? How does that work? What's your protocol?
So For our Minnesota soldiers, we're using Minnesota dollars to test them, you know, Minnesota National Guard dollars. For your outstate units that are coming here, I don't have any control of that, and I can't use my funding to help them. So, we're still allowing them to come to the installation. We have protocols in place when they have kids that they are either symptomatic. You know, in this case, kids were symptomatic, and that led them to hauling the kid to St. Gabe's and getting a test.
So
And
you don't do
once-
the test there at the,
Yep.
at the campus?
So we are preparing, we have 2 mobile labs from the Department of Defense on the installation right now that can test for COVID. They were supporting the folks at the Pentagon before they came here. The Department of Defense has given us those mobile labs to test the 4,000 soldiers that we're sending to the National Training Center. So that 4-day cycle that my kids gotta do here before they can go to California, all those tests be done in that mobile lab. But once they're done with that mission, they'll pull that lab and go somewhere else. So my units that are coming to Camp Ripley to train are relying on their health services through St. Gabe's. Obviously, you know, when Gabe started to see several positives coming from the installation, that spurred a message up to the state health department as well. So I was answering some inquiries back from the state level of what was going on. So I think the unit from Iowa did a great job. They had 2 positives. They did contact tracing. They identified about overall almost 60 kids that had contact with their positives, and they sent them home, you know, without any symptoms or without any testing. Now, our takeaway is it is incredibly important to test soldiers before they come and we put them into that combined environment. And I think that's the commitment you'll see from the Minnesota National Guard units. And that's the message we'll be giving back to outstate units as well. But, you know, we don't have any command and control function in that, and we truly provide resources for them to come here and train. But from my point of view, we put some things in place on the installation because it's a public health issue that we all share. It's not, normally I don't get into commanders' business if they have a kid that gets hurt or, you know, if it's a blatant accident or something like that, we do a commander's inquiry and understand why it happened so that we don't allow them to do that again. But a lot of their discipline issues and stuff like that, I never get involved with. This COVID thing's different though, because, you know, it's infectious, and so I have pieces in place now that whenever they owe me a message, whenever they either isolate somebody that's got, that they are concerned about, or if they send somebody in to get tested, that message flows up to me so I can keep track of what the hell's going on.
Commissioner Wilson?
Just one question on the COVID, maybe it's to Brad even. When we have our count in the county, like let's say we have 60 cases, does Camp Ripley count as that, or does it not, or?
I hope not. So far, no.
Okay,
Of the cases that were tested this weekend.
okay, just curious.
Now, yeah, and I don't know, you know, when the tests are being done at St. Gabe's, how that flows back and forth, that'll be interesting, I guess, but, I agree with you. I hope it doesn't count to your, you know, they're transient people. They're coming here, you know, in this case, Iowa should have 13 numbers more on their total count, but yeah, when it's all said and done, we're just trying to do the right thing.
Right.
Keep
Yeah, very
everybody
good.
safe.
Commissioner Jelinski?
Thank you, Mr. Chair. General, the very first thing that I want to do is I want to say thank you for everything that Camp Ripley, yourself, staff, et cetera, did for civil unrest, the riots, et cetera, down in the cities. Phenomenal. Thank you. And what an honor for General Jensen. Camp Ripley to Washington, D.C. Very classy, wonderful. During your presentation, I couldn't help but think a diamond in the rough, and I've said that before, Camp Ripley. What a gold mine, what a diamond to have in Morrison County, and the benefits that Camp Ripley can bring. Also wanted to comment again, and I know what a struggle, I know what a hardship the Joint Powers Agreement was. Thank you for everything that you've done with that Joint Powers Agreement, because nobody knows it. I mean, if you don't deal on it, nobody knows it, but that Joint Powers Agreement reaches all of Morrison County. I'm not gonna speak of outside Morrison County, I know that you go all kinds of places, but it reaches all of Morrison County, and that could not have been done and was not done with a lot of blood, sweat, and tears, screaming, yelling, hollering, finger pointing. A big deal. I can't speak loud enough in regards to that. Two more things. Thank you for that fire department that you got constructed up there. And I realize you're continuing construction on it. But I know what that was prior to. Another diamond, gold mine. And as far as the aircraft that you spoke very eloquently of, I like to say that my house is right underneath your flight path, which everybody says the same thing, of course, all the time. What an honor it is each and every time an aircraft goes over my house. Thank you.
Thank you. No, we're really proud of, you know, if I have one thing I'm incredibly proud of is, you know, 2006, when I hired Pat Boone as our advisor on fire and emergency services, and how much that whole piece has changed in, you know, 15 years. So, pretty cool.
Thank you, Mr. Chair.
Thank you. Thank you so much
All
for
right.
being here today and for everything you do.
Have a great day. Thank you for
You bet.
your leadership in the county as well. You know, I told the county, or the township board in Sullivan Lake the same thing, you know, there's not a lot of people sometimes standing to replace you. And so it's your dedication that's making it work. So thank you.
Thank you, sir.
Next on the agenda is Council on Aging. Welcome.
You're gonna avoid my last name, right?
I don't know. Go for it.
Thank you for having me again. I'm Lori Wilson, the Central Minnesota Council on Aging, and I always appreciate the opportunity to come and present to you guys each year. But this year, I kind of just wanted to focus on what's going on with our Older Americans Act grantees related to COVID. So, as you may recall, we receive the federal Older Americans Act funding, and then we allocate that out to area providers. In Morrison County, it's about $160,000 that gets awarded out for services here in Morrison County for older adults. And our three main providers are Horizon Health, Lutheran Social Services, and Min Legal Services. And then we have a small contract that we're trialing out with Home Instead, senior care. The providers that we have really done a great job since the onset of COVID to really revamp their service delivery to older adults and develop new partnerships to get the needed services out. And Horizon Health, so we fund Horizon Health for assisted transportation, homemaking, chore, grocery shopping delivery, respite, caregiver coaching. I think those are the basic services that we provide funding to them with. And there's several of those services that now have been suspended with COVID. So for example, their respite, they're not providing respite services in the home. They're not right now doing housekeeping services. Those are the key services that have been put on hold right now. They're primarily focusing on assisted transportation now that clinics are starting to do doing pre-visits for elective procedures. They're starting to do rides again for transportation. And individuals with dialysis are their two main transportation areas that they're doing. However, they have really been, the volunteer aspect of that has been hit very hard for them, as we're seeing with all of our programs that we provide funding to. Most of them rely heavily on volunteers. Horizon Health has 51 volunteers for transportation, and only 5 of them right now are active. And that's because majority of their volunteers are older themselves. And so, and if you look down below, you can see the chart that has actual individuals served in 2019. And you can see that they were providing rides to 48 individuals. Well, they had 51 volunteers, now they're down to 5 volunteers. And so like I said, we're seeing this across the board with our volunteer programs, when their main volunteer force is older adults themselves, and they're at-risk population. Most of their volunteers are in their late 70s, early 80s, and it's become a real detriment. One of the things that they're trying to do, especially for the dialysis, is match, in the past, they may have divided volunteer assignment for that individual to get into dialysis between 2 or 3 volunteers. Now they're trying to match them with 1 volunteer so they can have consistent match, and then try to reduce the whole area of additional exposure by additional people being with them. But it is a great, like I said, it is a great concern when we have majority of our services being provided by volunteers. We look at LSS on the opposite side. They are doing the grocery shop, or the home delivered meals in the congregate dining, and right now all congregate sites are put on hold, and probably will be until the end of the year. There's 7 sites in Morrison County. So instead what's happening is once a week their LSS is dropping frozen meal packs off at those sites, and then individuals can come to curbside pickup and pick up a week's worth of frozen meals. And then they're doing home delivered meal delivery to most individuals now. So typically in the past, home delivered meals were really focused on individuals who are very, very frail. And we do have a number of congregate clients that are now receiving home delivered meals during this COVID time, just to keep them less exposed. But similarly, with the meal program, in order for LSS to keep their dining site managers and cooks employed during this time, they're not using as many volunteers to do the deliveries. They're using that paid staff because the congregate sites aren't open, and so they're using those staff to go and do the deliveries. And so, which I understand the rationale for that, but once again, we are really gonna end up and this is across the state, a volunteer crisis when COVID is done, because there has been a decrease in utilization of volunteers. And so that's, just working with providers right now and really thinking about how to do volunteer re-engagement and how to look at, especially during this time, working with more youth and younger individuals for volunteer activism is something that is being heavily looked at. The grocery shopping there in the past would take as much as possible. The volunteer would pick up the older adult, take them to the grocery store, help them do the grocery shopping, maybe stop for coffee someplace, and then help them unpack their groceries, since there's a lot of socialization happening there. Now they're doing they're picking up the groceries, drop them off, knocking on the door, and then leaving to once again try to avoid that person-to-person contact. But that leaves a really big hole in that social aspect of it. So one of the things that we are doing is we're allowing our providers, where they're not using the dollars for respite and housekeeping, those types of services, to really look at doing telephone reassurance and friendly visiting, both over the telephone and virtually with these older adults, just to keep them socially engaged and making sure that they have the needed services. And so that's something that has been a real switch. We had a new contract this year with Home Instead, and one of the things we were trying to pilot, and they were going to focus in on Morrison County specifically, was to look at a model. So we fund Horizon Health for volunteer respite, and that meets a certain need, but individuals who need help with toileting or transferring, you know, that isn't something that the volunteer respite providers do. And so our concept under partnering with Homestead was that they could have paid staff and use the Title III money to cover that and be able to do more of that hands-on respite. Well, with COVID, that contract is all on hold right now too, just because, once again, the direction that we're receiving from the administration of community living at the federal level and the Minnesota Board on Aging is to really curtail any potential exposures as much as possible. And so, so a number of those services, as I said, are being put on hold. We did receive about just under $2 million from the federal government between the Families First and CARES Act. We're still waiting for our actual funding to be received for the CARES Act. Those dollars can be used for any service that we fund under Older Americans Act, but our board, and thank you, Commissioner Wilson, for serving on that and your leadership with that, has dedicated those dollars for meals as being the target focus for that funding. And so one of the areas that we're working with LSS on is to develop a partnership with at least one, if not more, food shelves in each of the counties that they serve, which includes Morrison County out here. And the concept would be to try to get frozen meals to those food shelves, and so that they can deliver a week's worth of frozen meals to the older adults when they're picking up their food commodities, as a way of targeting more low-income seniors and trying to make an impact on their whole nutritional risk. Food shelves is not an area that we have had a lot of working relationships with, and so we don't have good contacts for food shelves. And so Rachel, one of our program development staff people, have been able to get contacts for some, but in Morrison County, we do not have the direct contacts. So we know when they operate, but not actual individuals who we can be connecting with. So if you folks have connections that we can start entering into conversations with, so that we can work then with LSS. And so the food shelf themselves would not be having to produce the meals. We provide the funding to Lutheran Social Services. They cook the meals, freeze the meals, and then they would drop them off at the food shelf, and then the food shelf would get them out to individuals over age 60. So if you have contacts, I'm going to volunteer, we can give them to Brad or to Commissioner Wilson, and they can get them to me, and then we'll go out and make those contacts. But we'd like to get those going as soon as we have the CARES Act funding, which we're hoping that we have it by the end of this month, so we can start that effort. The other thing that's happening with the meal program is through individuals that are on the waiver. Oftentimes they're receiving the meal through Social Services, but their waiver is paying for it, but they cover one meal a day. And so Title III then, for the individuals that are on the waiver, can cover a second meal to them. So once again, those are more low-income, frail individuals that we're trying to target these services to. With senior linkage, we have an outreach site at the medical clinic here. That right now is on hold. So we don't have our social worker isn't coming here right now to do, to have regular outreach time. And we're not doing any face-to-face client contact right now. And so that is currently all being done over the telephone. We're trying to work with the state to make a change, at least with the return to community part of senior linkage, where we have social workers that work with individuals that are in the nursing home or the hospital and helping them develop a transition plan back home. But right now that is all being done virtually I'm sure at the county level with your clients that you're case managing, you know, there's pros and cons of being able to do that virtually, but you do miss a lot in terms of what's really going on in that home environment. We have been starting to do our Medicare 101 classes are really geared to individuals that are approaching Medicare or family members who are helping a loved one that's on Medicare understand the basics of that. Those typically are always done in person. We are doing those virtually now, twice a month, and that's been actually really successful because we've been able to reach people where we normally would have a class. I mean, some of these small communities, we wouldn't have enough volume to have a class. So we're really being able to reach seniors with that we normally wouldn't be able to. During open enrollment, during Medicare open enrollment in the fall, we normally would have several outreach sites here in Morrison County that we would be available to help individuals face-to-face do plan comparisons. We receive our funding for that from the Center for Medicare Services, and they are, the decision hasn't finally been made, but it's pretty close to it. They're really encouraging states not to do any face-to-face with Medicare open enrollment too. So that likely will also be done over the telephone. And those, you know, those are an hour to an hour and a half sessions. So it's a long time for many people to be on the phone. But when they're on, you know, 20+ medications, it takes a while to go through all that. You can see, like I said, the impacts in that chart is individuals that were actually served. So that's what you see down there. I did write a grant to the Minnesota Council of Foundations. We received $100,000 for that. And we're right now accepting grant applications through the 26th for any nonprofit, faith community, senior centers, and tribal organizations to apply. It's COVID disaster relief funding, so targeted for older adults. Organizations can apply between $1,000 and $10,000 for that, and 100% of that funding will be going out to the provider network, and we're hoping to make the first awards on the 13th of July so that we get those out the door as quickly as possible. But that, for example, is something, if a food shelf, for example, in order to do the frozen meals would need a freezer, that's something, for example, they could apply for these dollars for. And being that their foundation funding versus our federal funding, it's much simpler. And it's a much simpler, it's a one-page application, so. And that information is on our website. In terms of advocacy, there's a couple things just wanted to bring to your attention, because we're working with AMC as one of our partners on this, is around transportation. So there's two things going on that we're trying to do some legislative advocacy around. One is that what we're finding with several of our volunteer programs is that they're getting caught up in this rideshare classification. So volunteers, their individual automobile insurance carrier may say that they have to be classified as the same thing as an Uber or Lyft driver and have commercial grade insurance, even though they're volunteering. And so we're trying to change the statute to really clarify that volunteers are not rideshare, don't fall under the rideshare classification. And then the second thing is that is to have the mileage reimbursement not count as taxable income. To raise currently volunteer mileage reimbursement is at 14 cents, and anything over 14 cents is taxable. And so we're trying to, that's a federal issue, we're trying to raise that so that it's just set at the business mileage reimbursement. So those are two things that AMC has been helping us on. We had down with one of our volunteer drivers programs for a hearing in the tax committee on, it was a Tuesday, and then on the following Monday, we were supposed to have a hearing in the transportation committee, and everything got shut down. So we're gonna have to be going back and trying to re-synergize all that again. The second thing is that, what I'm hearing, from DHS is that we should expect between a 10 and a 15% cut in about all of our state funding, which would include state nutrition. And so we are starting to gear up for, and working with our nutrition providers to do advocacy around that, so that the hope that they can be exempt from that, because that would be, is a critical service, and would be, any cut in our nutrition right now would be a real issue. And then the last thing that we're working on advocacy on right now is to have the reimbursement for PCAs to be raised to $15 an hour under reimbursement. One of the things that we don't fund PCA services, but obviously they provide a lot of support to disabled and older adults that are living in their own homes as personal care assistants, and organizations that they're losing their staff right now because of the additional $600 a week for unemployment. And so, at least during this COVID period, those wages needs to be increased so that we don't continue seeing the shortage that is happening right now in PCA. So those are the main advocacy pieces right now that we're working on. And I would just thank you for, the annual, Morrison County provides us with just over $2,000 of match annually, and that helps us with our administrative match that we need and draw down the federal Older Americans Act fund. So I thank you for that. Are there questions or?
Mr. Chair,
Commissioner Wilson.
you answered most of my questions, because I think one of our problems with getting volunteers is the mileage.
It is.
You know, when we get 58 cents or 55 cents and they get 14, and then you start putting taking salary on top of that, and then the insurance piece was a big piece for them, because that raises their insurance. I can see why we can't get volunteers.
And in
know.
Morrison County, if I may say, so, we've done a really big analysis of all the volunteer drivers programs in the state, and we really see that insurance issue happening in pockets. Horizon Health has lost many volunteers because of it. So it's happening by certain insurance companies more than others, and so it is definitely impacting here in Morrison.
I notice that we get like 5% funding. Is that an average number for counties? I know I sit on there and I see
Yeah.
some are a lot higher.
And that's why Morrison County is 5% of our 14-county, 60-plus population. What we award out for services in Morrison County is coming in right around 5%. What I would say is in the last several years, there has not been 5% utilization. We have awarded out funding. Horizon Health in the last couple of years has not extended their contracts. We do them on contracts versus grants. So we negotiate a rate for a service, and they're reimbursed for each hour of service they're provided. And so that was one of the reasons why we looked at having a new contract with Home Instead to come in and try out respite out here, to see, if we need to make some shifts from volunteer services. Horizon Health in January here made the shift to do a blended model between using volunteers and paid staff to do housekeeping services. And in January and February, that was working very well, and they were able to serve more people. But then COVID hit, and now that's on hold. So, but that is one of the reasons why so we're really diverting all of our extra funding. So if we have the new funding that we received in, as well as any carryover funding that we had because of the state of emergency, we are allowed to use that for any category of funding, and that's all going towards meals, which is one of the reasons why we're looking to partner with food shelves to really get those out. So hopefully we'll see some increase in meals going in Morrison County as well then.
Tabitha, do we have a list of food shelf places?
Yeah, absolutely, yeah.
With who's in charge of them?
The
Good.
Yeah,
contacts?
Brad has all that information. He'll get them to you, Lori.
Okay, that'd be great.
Okay, so,
Commissioner Jelinski?
Thank you, Mr. Chair. That's exactly where I was going. I was looking right directly at Brad, and I was gonna say, Lori, that I think that we have a giant resource right here for you. My question, though, is I think there's 3 food shelves in Morrison County, Little Falls, Piers, and Motley. Right? And I know Pillager has a food shelf also. My question is, and I don't know the answer to this, I know Little Falls has a freezer, a walk-in freezer. I have no knowledge of Piers, I have no knowledge of Motley. So the funding that you're talking about, and I'm just being very bold, I don't know the answer. I don't have a freezer. Is there enough money there to actually add on to my facility, to add on a walk-in freezer? Or could there conceivably be enough money for that?
So the grants from the grants from the Minnesota Council of Foundations are capped at 10,000.
Okay.
So I don't know how much a freezer
Okay.
costs. I know we do, I know that when so we have food shelves in the central and eastern part of our county. We have food shelves in every county. In the north here, that's where we're working on right now. And Brainerd and Hackensack are just starting. But what we have seen is there's been a couple of those communities who have needed then freezers, and they've been able to obtain the funding from the local Lions and
Oh, okay.
different groups like that, so it hasn't been an issue. However, this would be something that they could apply for.
Sure.
So, if
Well,
that's an issue, then.
And with COVID, I'm going to anticipate that our food shelves have been tapped to unending degree, is my guess.
They have, and I know we had about 6 staff in May come to Little Falls here to help because they were in need of volunteers that come and help out. We don't fund them, but they need it. They put the call out to us for need for assistance. But they're also running with shortages. And so that's why, once again, if we can supply them with the frozen meals, then they can distribute them.
And my question even bigger than that is that if X food shelf has a frozen ability of whatever kind it is, walk-in freezer, a great big chest, I don't care, I'm anticipating that they currently have a need for that frozen area. But there would be funding available perhaps somewhere along the line, and there is, up to 10,000, to add on, build whatever, another, okay, very good, thank you. That was my thing that came to my head, so thank you.
And I know in some communities, I think it's Rush City, for example, they don't have the space for the freezer,
Yeah.
but they were able to work with a local, I don't know if it was a restaurant or whatever, for some freezer space.
Oh.
So, there's different
Okay.
ways that we can work that out. The freezer is the smallest issue.
Okay.
The big thing is it has to be during, daytime operations, or somebody has to be there so that when Alice delivers, there's somebody that can take the food.
Sure. And then I did have one other question, if I may. When you talk about the assistance that you give during Medicare open enrollment, is that capped to, who's eligible for it? Is anyone eligible for that service?
Yes, so.
Being very bold when I say
that's-
anyone.
Yeah, so with senior linkage, anybody, we serve people 60+, there's no charge for any of the senior linkage services.
Okay.
But we do serve a lot of people that are under age 60 with Medicare and prescription drug assistance. So there's many people that are under age 60 but on Medicare too.
Okay, very good, thank you. Thank you, Mr. Chair.
Commissioner Winter?
Thank you, Mr. Chair. Lori, with this, it's just when you say you're putting out a crisis for volunteers, I mean, if you had 51 before the virus and now you have 5, I can see that's just, that's just for the counties, right? I'm hoping it's just for the county, it's not the counties that we're serving.
That's just Ellison, that's just Horizon Health.
Oh, right, okay.
So,
How many volunteers do you have with Verizon Health and currently, if you can answer that question? And when you brought up that there's no restrictions or whatever, what's the wait time? And I know this is in my wheelhouse, kind of, if someone calls, do they have to set an appointment if they want to be taken to the doctor? Or, with these volunteers, do they get tested, for the virus? Just a couple questions out there.
yeah, so, the wait time for a program like transportation, I really, that varies by program. Most of them are not able to do, like if you called up now and said, I need to get to the doctor's appointment in 2 hours,
Right.
they're not gonna be able to meet that need. With meals, they can get the meals out the next day. So if somebody is being discharged from the hospital today and they need meals tomorrow, Lutheran Social Services will be able to meet that need. But with the transportation, they need to coordinate that with the volunteers, and it's based on the availability of the volunteers, which, in March and April, even in May, when we were having conversations with our Title III providers, they were saying, the older adults have canceled all their services, mainly because the clinics canceled all their appointments. And they're not wanting to, they're not going, they're staying, they're sheltering in place. And so, during that point, there wasn't a demand for the service. Now that's starting to pick up again, and they don't have the volunteers. So it's a big issue.
I can see that, thank you.
Anything else, commissioners?
Thank you, Lori.
All right, thank you, Lori.
Thank you.
Thank you for the information.
Yep, thank you.
Have a good day.
You too.
Next on the agenda, Sheriff's Report. Good morning, Sheriff.
Good morning, Sheriff.
All right, so the first thing I'll go over is the monthly report for the month of May. And as always, we try to provide a photo of some of the events. This month, we only have one photo, but it was National Correctional Officers Week. So we took a photo of the staff that was present working at the jail that day. So it was in 1984, President Reagan actually proclaimed the first week of May will be National Correctional Officers Week. So you notice the social distancing going on as well with that photo. At least I thought that was funny.
Well done, Sheriff.
As far as training goes in May, we had, it actually says rifle qualification training, but that's an error. It should have been rifle zeroing. We zero our weapons annually just because all our deputies all the full-time staff have take-home squad cars. So there's a rack that we lock our weapon in. And because of the movement and everything else that goes on, we just make sure that our aim point sights are on, our iron sights are always on. And that's what we did last month for training. Moving on to our criminal complaints, I'll just kind of highlight what we're seeing as far as the biggest areas that have the most attention, and that's our assaults. That in the top portion, you'll see blue pie at 13%. We had 7 assaults, which was 3 assaults, 2 domestic assaults, and 2 terroristic threats complaints. You'll see the purple, which we're going to go over later, is our drug complaints or our drug investigations. 19%, which is 10. We had 10 drug complaints that we dealt with in investigations. And then our thefts, we had 10 thefts. which is the blue portion on the 9 o'clock position, 19%. Any questions on that at all? Moving on to our traffic citations, we had 129 verbal warnings, 23 written warnings, and 19 speed citations that were issued. If you look at our 2-year comparison, everything was pretty much down this year and compared to last year. Of course, with our civil process and our inmates, a lot of it had to do with COVID-19. But you'll see our drug investigations have climbed. And again, that's because we have 2 people on our, on our drug task force right now. And we talked about it takes a full year just to get all that training, and now they're up and at it. So they're doing well. As far as our jail goes, we had 25 inmates in Morrison County. And again, because of COVID-19, we didn't house any out-of-county inmates. We are in the talking stages right now with Itasca County. Their count is going up as well. So we're communicating back and forth. They want to know if we'd be able to hold any of their inmates. We informed them that we would. They would just have to go through the screening process, which is what we're doing now for any inmate or anybody out in the public that we arrest. So hopefully those numbers out of county inmates will see a rise. Outside of that, I guess we averaged 25 just because we didn't get any out of county inmates, so our total population for the month of May in our jail was 25. As far as our drug investigations, I'll just give you a quick summary. They did, when I say they, our task force members, they did 4 controlled purchases of methamphetamine throughout Morrison County. Of course, they list the cities for me, but they're really reaching the rural areas, which is what I like to see, because we didn't see that at first. But when you have 2 people actively working and taking in all the complaints and reviewing the tip line information, and it just seems like we have more of a handle on things of what's going on. So trying to get out of the Little Falls area is a goal of mine, because Little Falls is 90% of our cases. So it's still a priority, but so are the rural areas of our county. So we had, like I mentioned, 4 active cases going on with controlled substances where we're purchasing methamphetamine, utilizing an informant. Our goal is to try and get up to that first-degree sales case. And by statute, we have to have 17 grams of methamphetamine within a 90-day period in order to reach that threshold. So basically there's gonna be multiple buys that are gonna be done to try to reach that threshold. So when I say that there's a controlled purchase going on, that's just one incident. And if they do it multiple times, they're only gonna claim one incident. So in other words, we're not gonna have multiple incident reports, ICRs. They've also been busy with drug interdiction stops, so they're utilizing the informants that we have. They're also doing drug interdiction stops when they have time to try and get more informants. Plus, they're feeding off information that we receive off our drug tip line from the community members. Sometimes they'll sit on a house, do surveillance, and there's just not enough activity for us to, get a search warrant and act on that. So they're watching the house and making stops based on reasonable suspicion and probable cause. And some of these traffic drug interdiction stops that they have done have created more informants that they're working with. Outside of that, we had an overdose, heroin overdose in the city of Little Falls. Our task force members followed up with this. They were able to basically get a statement from the victim involved and all the witnesses present at the residence. Based on that, they did a search warrant and were able to locate some drug paraphernalia, which basically led to an active arrest warrant that we have out for one of the subjects now. So the guys have been really busy, and I commend them for the great job that they're doing. But that's just really a summary that they provided me, but obviously they're doing a lot more than what I just stated. Any questions on that? Okay, the next item, which I tried my best to figure out how I could pay for this gear. What it is, it's a request to purchase mobile field force protective gear for deputies at a cost, and I have $19,062. But if you add up some more equipment that I'll get into in a little bit, the total is handwritten on the bottom, $27,012.99. So it's equipment for officers, and what I would do is I'd utilize a line item. Right now, we have a line item in our budget, which is equipment for officers. I have some funds available in that line item, and the reason is normally, routinely, we're purchasing items for medical purposes that would be coming out of that line item. But because of COVID-19, we're coding it differently, and I'm not touching that line item. So the big thing is I know that with this amount, it's gonna exceed what we budgeted, which means therefore I'm asking permission to go into a reserve fund to utilize the remainder of that money. So just because of all the civil unrest and the peaceful protests that have turned into riots, other law enforcement agencies have been calling upon us and other agencies statewide for assistance. We've supported other agencies to include Washington County, St. Paul PD, and as well as Anoka County. And all of our work has been done in the Minneapolis area. So we've been not on the front line because we don't have all the equipment. So if you can visualize, a front line would be basically all your gear to include a helmet, a shield, a wooden baton, gas mask carriers, a belt, and then there's protective equipment that goes with that to cover your limbs, your forearms, your shins, etc. So we don't have all that gear. So the problem is they've been calling for bodies, and we've responded, and we've basically assisted wherever needed. But again, we weren't on the front line. So I just want to make sure that our guys are prepared, and if we ever need to tow that front line, if there's an incident that occurs where we need to be on the front line, I want our guys to be prepared. And unfortunately, there comes a cost with that, and that's the overall cost, not to exceed $27,012.99. I mentioned that we assisted in the Metro. We also assisted here, not too far away, in St. Cloud. We assisted the St. Cloud PD. So the incidents in the Metro was May 30th, 31st, June 1st, and we assisted St. Cloud Police Department June 15th, and then we were called back on the 16th as well. So those are just some of the incidents that we assisted on, and like I mentioned, we want to make sure that if we're utilizing our staff and these other agencies are looking for numbers, we're not only providing our staff and their skills, but we're also providing them with the equipment to keep them safe and protected as well. Any questions for me?
Mr. Chair.
Commissioner Wilson.
Sean, how do you determine when to go somewhere? I know like right now for the riots, and I kind of approve of that. But if they would ask you to come down because of all these shootings they're having and stuff like that, because where I feel maybe they don't have enough law enforcement of their own, I guess I would question whether we would go down to that situation.
Absolutely. That's a good question, Commissioner. So we're a small agency. We don't have a lot of resources like the Metro has. However, basically in these instances, number one, I get a call directly from the sheriff from Washington County. I get a call from the commander of St. Paul, and then I got a call directly from Anoka County sheriff. So in these instances, it was, hey, we need your assistance, can you help? And basically, without the gear, all of our deputies do not have the gear, but our SWAT team, they do have some protective equipment. So in this case, we're only able to utilize some of our SWAT team members. So when I got a direct call and they say, hey, we're exhausting our resources, we need any help from any of your personnel, can you send anybody? My question to them is absolutely, we'll send as many as we can, knowing that it's not going to be a lot. And of course, we have to take in effect that something could happen here locally. So if we're maneuvering 2 hours away, we're not going to send our entire SWAT team. We have to keep members back just in case something was to break out here locally in Morrison County. So what we did was just utilize some of our SWAT team members. But to answer your question, in these cases, it's been a direct call from the command staff from these agencies saying they've exhausted all their resources from local departments. Now they need to reach out further, and they're asking for any trained personnel with equipment to assist as well.
I suppose where my question's coming in a little more, if they talk about defunding Minneapolis Police Department and they have all these shootings like they've had the last couple days, when do you draw the line on, I don't come down and help you because you need to take care of your own financially and stuff? Maybe that's putting I don't know if I'm asking that correctly, but I feel differently about that versus a riot or.
No, I agree with you. I think there's local agencies surrounding the metro, more of the suburb areas that have already made it clear that, you know, we helped you regain law and order and control of your city because you needed it. But now it's really on you to figure things out. And I'm in agreement with that particular statement because I think this could be a never-ending situation unless they figure things out.
Thank you.
Commissioner Jazinski.
Mr. Chair, I'm going to take a bite of the elephant here. And the bite of the elephant is about $27,012.99. And Sheriff, I mean this in all respect, and I know you know that I do. We haven't had this equipment in the past. My first question is, should we have had it? And I'm anticipating the answer is yes.
That's a good question, Commissioner. I can tell you that I started in 1999, and we started with the, I believe they were called the M17 military gas masks, which were utilized in like the Vietnam era. I can tell you I went to boot camp in 1993 in the Marine Corps, and we utilized that gas mask. In the mid-90s, the military phased those gas masks out. So because of that, we received those gas masks, and that's what we currently have. I can also tell you that I've had my staff who are assigned, or who are in charge of the gas mask, look to see if we can get any parts, if we can get any cartridges, i.e. if we're gonna deploy gas, and there is no replacement parts for that. And that's why we're really looking into this, because that's part of the equipment and the gear that we would need is these gas masks. And as you're aware, just watching what was unfolding in front of our eyes in the metro, sometimes to remove or push a crowd back, gas is needed and gas has to be utilized. So I wouldn't want to put our staff in a situation where they didn't have the right gear. So unfortunately, that's part of the issue, is everyone's going to need gas masks. The only personnel that have them now is our SWAT team members, which our team encompasses 5 members of the Morrison County Sheriff's Office, 5 members of Little Falls Police Department, and then 1 member from the Pierce PD. So it's only 5 gas masks here in Morrison County that we actually own.
And I want to be very clear, I fully support everything that you have done in the process of all of that, as I would support any other agency supporting us in the time of need, and thus, that's why we do what we do. And I'm very clear on that. This 27,000 would then equip our staff for any, be very careful on that, for an event in Morrison County. That, I think we have to take care of Morrison County first in the conversation. that this is our equipment and that will be utilized here in Morrison County. Certainly, if we got called to XYZ County for support, again, which I do support you in how you handle that, and you know that. But first of all, this equipment is for Morrison County staff in the event of XYZ.
Correct, Commissioner. This gear would go directly to the deputy, and then he would be assigned that gear, and it would stay in his take-home squad car. So, i.e., they get called to the event in Morrison County, they would have the gear on them. And maybe I should, if you guys want, I can go over some of the gear, but I gave you the worst-case scenario, and that's $27,012.99. Now, if we take everything into consideration, minus, I call it the turtle suit, that's the protective gear that goes on your forearms, your shins, things of that nature. That alone was $8,000. Now, I give you that number of 27,000, again, being the worst-case scenario, because I believe I can work back from that number. And what I mean is, we all have to carry soft body armor right now. So to me, it doesn't make sense where I need a chest protector if I'm gonna have my soft body armor on. But when we get the quote, I put it all in there because at the end of the day, I just threw all the numbers together. But I believe, like I said, we can work back from this number. The rest of the gear I feel is a necessity just because the feedback that I received from our members who were down in the metro area, you know, they made comments to me saying that people were throwing rocks, they actually threw knives, they were throwing bricks, things of that nature. So the last thing I want is someone who would be injured, and then now we're looking at a injured on duty claim that's gonna cost us probably more money than this overall number that I'm asking for.
Without a question, Sheriff, just one more comment. When you spoke of funding, you've got a line item that covers at least a portion of this, and then you would have reserves that would be of no, careful on how I say this, of no giant issue utilizing those reserves. You wouldn't be emptying out the bank, is what I'm trying to say.
Correct.
To take care of this.
Correct, Commissioner. I'd be using some of the proceeds that are assigned for jail programs that we've, over the years, have increased significantly just because of the out-of-county inmates that we have housed.
Okay.
And again, I would use, I'd utilize the line item of equipment for officers, and then anything that would exceed what was budgeted, I would ask to take from this fund, the the jail program fund.
Okay. And my last comment will be, if we're gonna have a law enforcement agency that is ready to respond to whatever it is, we need to have our law enforcement agency as equipped as we possibly can have them. I thank you. Thank you, Mr. Chair.
Commissioner Wilson?
John, is this for enough equipment for what, 2 people, 3 people, 5 people?
What was that?
Is this enough additional equipment for what, 3 people, 5 people?
So as of right now, the number is 25.
25 people?
Correct.
Be able to, okay.
Yep. And the reason for that, Commissioner, I can kind of, maybe I should do a better job of shedding this presentation, but we are all trained in mobile field force. And this just happened, let's see, we were deployed down the metro May 30th. So it would have been the Thursday before May 30th. We had 2 instructors from Carleton County. They came down to train our staff. And when I say our staff, it was our entire staff. So we want to make sure that we're all prepared and trained in this. And of course, this is a list that was presented to us from their agency as far as what all the equipment entailed.
Yeah.
Mr. Chair, I just wanted to point out the world is a different place as of late. And so while Sheriff Larson is talking about deploying elsewhere and the assistance that we provide, this could happen at home. I don't think anybody's exempt from the world we live in and emotions and feelings and thoughts of the general public. And so I just want to I don't know, not forget to that point, and I think Commissioner Jelinski touched on it a bit, but it's not just about going out and helping others. While that's good because we may need their help in return and have in the past, I think it's about making sure we're equipped to keep those that are working to protect Morrison County citizens safe, because if they're not safe, they don't have the ability to protect those of us that rely on them to be protected. I just wanted to point that out.
I just use different words.
Commissioner Blaine?
Thank you.
Commissioner Blaine?
Mr. Chair, Sheriff Larson, I don't have your budget in front of me, but help me here. In the past, when we looked through a number of line items on the sheriff's department budget, I thought I remember a line on there that when we talked about that was set up to utilize, or that line item was for kind of this very thing for equipment in case we would have officers that would be deployed to help ease tensions in the pipeline construction and that situation where there was some unrest in the past, both in and out of state. I thought that there was money in that line item set aside. Is that correct, or am I?
So the pipeline would be two different things. I can tell you here locally or here with the assistance, when we assisted the metro agencies, there'll be money available, hopefully, that we may get reimbursed for our time, but nothing to do with the equipment. Now, looking forward, which I don't have the crystal ball looking forward, but in the event something would occur where our calls for assistance would put us in a different location, yes, it's possible we may get reimbursed at some point for some equipment. But as far as riots and anything to do with the George Floyd incident or anything to do with peaceful protests getting out of control, there is no funding. And I actually had our emergency manager look into this as well before I came in front of you to the board, just because I wanted to make sure if there was some funding, some state funding, whatever it may be available, I wanted to look into it first, but there's none that I'm aware of.
Mr. Chair, if I may? Thank you. So Sean, would our involvement in peaceful protests or civil unrest outside the county on an issue not related to some of the racial violence that's happened, let's say the pipeline, let's say the construction of a pipeline in Minnesota, is there any difference between those two scenarios?
It's possible, and that's why I look at it right now as, do we need the equipment? If something happened today, would we be prepared? I can't honestly tell you that we would be prepared, and I think we'd have to rely on some different agencies. And I don't feel it's right that I have to have Minneapolis or Washington County or Anoka County toe the front line for us because we don't have the proper gear. And I know you'd agree with me, Commissioner, on that, but to answer your question, I think we need to get the gear, keep track of everything, and if that, what you're talking about arises in the future, then it's fully documented, and then I would certainly ask for any request for reimbursement if it was available, if that answers the question.
Okay, and I think we're getting there. So back to your request here, in looking to expedite here a little bit, but so the $27,000, you're kind of portraying this to me or to the board that this is coming from two different sources within your control and in your budget there. So going back to my initial question, is some of this money coming out of that line item that I kind of remember about for equipment that was kind of in the foresight of our troops having to address civil unrest? Is that correct?
Well, not really, because the equipment line item I'm referring to is just a line item that is used every year annually. However, there is more wiggle room this year because of the COVID-19.
Certainly.
But as far as anything that could be utilized for the purchasing of equipment set aside, there is nothing set aside. And in the future, if something does arise, I guess as far as I know right now, there's nothing even in the future set aside that says, hey, go ahead and purchase this, it's gonna be covered by this line item. I don't have any of that information. What I do know is that in the future, if something arises, we'll certainly hold on to our invoices and ask for reimbursement at the time if we're able to.
Okay, and so, Sheriff, you know, that might bring this more to light to me, and I apologize not having a copy of the sheriff's budget in front of me. I know we've had that conversation that happened shortly after I came on the board here about that, and we might have highlighted that as a line item or a possibility or a place where we might have to look at investing money in the future, and there may not be money attached to that line item at this point in time. And so understanding that we're looking at the two sources which you're looking at accessing to utilize this $27,000 from to achieve this protective equipment. So, Mr. Chair, to that point, if you're looking for a motion to authorize the sheriff to move forward on this, I will make that motion at this time.
Motion made by Commissioner Blaine to approve the request for protective gear for the deputies. Could I get a second?
I'll second it with more conversation, please.
Second by Commissioner Wincher. Discussions? Commissioner Wincher.
Thank you, Mr. Chair. Sheriff, I'm all for keeping our police department, sheriff's department here protected. I mean, I'm 100% on that. I do have a problem when you have councilmen, again, maybe this is the political, down in the cities, saying they want to defund their sheriff's department, their police department, but yet then their sheriff is in a catch-22. Well, we need help here. So we're actually helping those people that were elected down there to come and protect their people because they don't want to pay their, sheriff's department. So my question would be, is this like kind of a handshake contract throughout the state? I know we have contract with Stearns County, but outstate, we can go and help them.
Mm-hmm.
What is it is there a protocol that anybody calls that needs help? Is it a thing that you just do as a sheriff's department, or is this something that you think about it? If we don't have to protect, we don't have the right equipment, you don't send them. Is there counties that didn't send people down there? I don't know.
I'm sure, yeah, there are counties that they're not trained in mobile field force. They don't have SWAT teams, so therefore, they weren't utilized. We were utilized, and I think what happened was at the time is with Washington County, no, we have no agreement in place as far as a mutual aid, but we have a sheriff calling and requesting, and it's like, I'll be honest, if we had time to plan everything out and I could bring our county attorney in and come in front of you, commissioners as a board, I would certainly draw something up. But in this case, it was sporadic, everything was unfolding. Buildings were getting burned, rioters were taking over on the streets, And again, they exhausted all their resources, and now they're looking for outside rural agencies who have the training, who have the means and the skills and the training to come assist. And basically, if it wasn't a direct phone call to me from any of these commanders or sheriffs or lead officials asking for our assistance and telling me they've exhausted all their resources, we probably wouldn't have sent anybody. It's not like I was just gonna volunteer our staff to say, hey, go down there and see if you can help out. This was, like, again, the sheriffs and then St. Paul PD command staff calling me saying, we need your assistance, can you please help us? So, and reassuring me that if anything ever happens in Morrison County, they'd be the first ones to assist us as well. So basically, yeah, it's just a call of desperate need, but if there was anything in the future where I knew or I had time, I think I would try and do that joint powers agreement.
Thank you for that. Thank you, Mr. Chair.
Any other discussion? Gentlemen, this will be a
Mr. Chair, if I may, just for 1 second, I just want to echo, we're in a whole new world than we were a year ago at this time. I'm going to echo, the equipment that you're talking about is not something I have in the back seat of my car or in the bed of my pickup truck, because I don't need this equipment. It's not my job. This is the job of the people that work under you. It's our job to provide the equipment that they need to do their job. I don't believe we're providing the equipment for your staff to do their job in Hennepin County. We're providing the equipment for your staff to do their job in Morrison County. And by golly, if Hennepin County calls you and says, Sheriff, we need some help, then it's our duty, in my opinion, to help them, because I personally have dealt with this in the past, so have you. If you need some help from somebody else, it's amazing. They come. So, thank you, Mr. Chair, thanks.
Any further discussion? This will be a roll call. Commissioner Winter?
Aye.
Commissioner Jelinski?
Aye.
Commissioner Blaine? Commissioner Wilson?
Aye.
Myself, aye. Motion carried.
Thank you, Sheriff.
Thank you, Sheriff.
Thank you, Sheriff.
Next before the board is Social Services, Cindy and Brad. Good morning.
Morning, Cindy. Morning, Brad.
That came through, so. Again, good morning, Mr. Chair, Commissioners. Today, we're gonna talk first about long-term care services, and these are mostly for 65 and older, but there are some disabled and other individuals who qualify as well. But thought we'd bring you some information on where we're at.
So, as he said, it's our yearly report on it. As far as alternative, I'll just jump in right away. Alternative care, that is something that's handled through public health. They work with people before qualifying for medical assistance. Elderly waiver, that requires a MA application, but that program is for keeping people out of facilities. It keeps the cost down for the county, the state, the feds. The next piece, I guess, I'll just try to buzz through this. Facts, 70% of people over 65 will at some point need a long-term care in their lives. 40% of all long-term care is provided to persons under age 65. The primary goal of long-term care is to help elderly or disabled people maintain as much function and independence as possible for as long as possible in the least restrictive environment while ensuring their safety, comfort, and well-being. I included in there exactly how many people were on which program in August of 2019. We had a total of 507 residents receiving some type of waiver assistance. Health insurance and Medicare. Medicare only pays for long-term care and waivered services in very limited circumstances, where the difference between healthcare and long-term care, the long-term care will cover it for extended period of time. So even an elderly waiver, we have people in their 90s living in their home because of this program instead of ending up in a nursing home. Who's paying? Medicaid covers 47% of all these costs. 23% is covered by Medicare, and 23% by families themselves with out-of-pocket expense. The next piece regarding peacetime waivers, they have allowed us to suspend renewals and any reporting forms. What that means for everyone is if they had a renewal due, they were not sent paperwork, we don't have to process it, they're automatically eligible. The only people we are closing currently are ones that have moved out of state, have passed away, or have actually requested that their case be closed. That includes people on MAEPD, which is medical assistance for employed persons with disabilities. If they're unable to afford their premiums right now, they retain eligibility, but they will be expected after the waiver to catch up on those past premiums. But they want to be sure no one lost coverage.
And actually, just one more comment. This document in front of you is actually a much broader description of all of the waivers in our financial assistance program. So some of our within Cindy's program area, some of our are within Karen's program areas and family and children's. So can go over more with Karen's report in a couple of weeks, but I wanted to put this in front of you. If you have questions, you can maybe think a little bit about it. But it has, as you'll see in some other reports, reduced the calls, the walk-ins, things like that, because of the ability to delay renewals.
Mr. Chair?
Yes.
Cindy, if I might interrupt you for a second, as long as it's right in front of me. I believe I know the answer, but I'm gonna ask it anyway. 23% is covered by families' out-of-pocket expenses.
Correct.
That's a great statement to make. And there is no family, because the pockets are empty. Where does the 23% come from? Gotta come from somewhere. Do you know the answer to that?
I guess I'm not actually understanding the question, Commissioner.
We must have a bill. 47% is paid by Medicaid,
Correct.
23% is paid by Medicare, and 23% is paid by families' out-of-pocket expense.
That
in
does
per-
mean the people with
That's
the
right.
means.
That person has no means. Where does that 23% come from?
Then they're going to be referred to Medicaid.
All I needed to know. That's all I wanted.
Mr. Chair, that's a total cost breakdown, not a per individual person
Oh, I'm sorry,
breakdown.
I'm misunderstanding.
Yep.
Yeah.
Does
Okay,
that make sense?
Yeah,
Okay.
absolutely it does. This is not per person.
correct.
This is the picture.
Yes.
Thank you. Thank you very much.
Thank you, Deb.
Sorry, thank you.
No, my fault. The next slide is long-term care applications taken over the last 3 years. And then I did it through the month of May. As you can see, in April and May, the applications went down drastically. That's partly due to COVID, and some of it's due to a shift in applications from my unit to Karen's unit, so that it was healthcare that didn't have long-term care that didn't make sense to be with the long-term care workers. So applications haven't went down per se, they've just moved to a different area for processing. Our long-term care phone calls per month, as you can see, those have decreased dramatically as well, and that's mostly due to everyone's needs are being met right now. No questions on, what do they need to get in for the renewal, because we're not doing that paperwork. On the next slide is Medicare savings programs. This is how many people are on each program in Morrison County. So a total of 889 Morrison County residents are having their Medicare premium paid for them. So that's saving each of them about, on an average, around $145 per month. I gave a little information on housing support. We have 203 residents in Morrison County that receive that assistance, and that is putting people in like assisted living. The program used to be called GRH, Group Residential Housing. That too is a big savings over a nursing home facility. It's more, like I said, assisted living, and we just pay that premium. And I included a slide on activities across all programs in the long-term care unit. I would direct your attention to the bottom where it says net expenditure when it comes to the SNAP program. In the year 2019, Morrison County residents spent a total of $1,729,973 in our community through the SNAP program. So that's Coburn's and Walmart, and I don't know the name of the store in Piers, but all of those stores benefiting from those SNAP dollars. And finally, my last slide is just some new information on county burials, showing you what we have spent through the month of May for county burials. We have had an additional, I believe, 6 more so far in June. Any questions?
Any questions, gentlemen?
Just one more comment on the waivers, and that is that some of these have actually been extended through June of 2021. A few of these in the financial assistance area. And the ones that were not extended, there will be a 60-day ramp down period. So at some point, all of these individuals are gonna have to be, their programs are gonna have to be renewed, all the household report forms will have to be done. And so there will be work to catch up on, and like in a lot of other areas of our communities because of COVID-19, so.
Deb?
Mr. Chair, I just want to say, we've recognized as an organization where there might be some time, and Cindy and Karen's unit, when it comes to some of the delays in processing or the needs that aren't there, that are normally there when it comes to doing that, they're being redeployed, and they've stepped up and said, where can we be of use? And so we are utilizing that staff in helping with funnel traffic for our motor vehicle area and serve as a kind of a greeter position when it comes to redirecting people with our parking lot and how, the area, the complex in a whole is a little bit of transition right now. I was going to use a different word. I was going to say that. But they've stepped up, and we're fully utilizing staff that does have some time right now. And so I appreciate everybody being willing to do their part wherever it is they're needed. And that's something I think that sets us apart from other organizations. And this is one of those things that, one of those examples of that. So thank you, Cindy, and pass it along to Karen, please, too.
I will.
Thank you.
Thank you.
All right, I'd ask Bonnie to come up. So as you might recall, at our planning meeting last week, we talked about the debt management policy. Part of the state auditor's requirements now is to have this policy and manage our debt. And so Bonnie is here. The first page of the handout is really kind of the changes from our current debt management policy to our new debt management policy. So I'll just have Bonnie go through a little bit of the changes that we're talking about.
Good morning.
Morning.
So basically, the document was reorganized and just clarified to start, and updated to include both policies for public assistance and social services. We used to have 2 documents out there. So each January, the agency will review all of our debts that are in the system, and based on the policies below, apply those cases and see if we should be writing them off. The state is now taking that into consideration when they're looking at an overall budget. Made the updates to number 4 of the public assistance to reflect the federal policy changes. And then on number 2 and 3 of social services, I changed it from 3 years to 5 years. It seems like we might be able to get a few additional collections if we look at it a little bit longer down the road, so I thought it was just a better time frame. And that's really it. Everything else is just kind of pulled from the statutes and state manuals, different things like that.
So if I call you attention to kind of the last page of that handout too, is kind of, again, what we're referring to are the claims. And we talked a little bit about this at our planning meeting, that currently we're considering writing off $80,000 in uncollectible, so we would consider it uncollectible, which means the family doesn't have any resources, they're disabled. And what we're saying is, then there would be about $841,000 that we're hoping to collect. We know that's not probably going to happen, but again, we determine fees based on what the costs were, not necessarily their ability to pay across a number of these programs, so.
Gentlemen, could I get a motion and a second for this?
I'll make that motion.
Second.
Motion made by Commissioner Winchester, second by Commissioner Jelinski. Any discussion?
Mr. Chair? Go ahead.
Commissioner Blaine?
One question. In the previous slide or a few slides back, you referenced, Bonnie, the agency will review this in January. The agency being DHS?
No, the agency being Morrison County Support and Collections. So
Okay, so this-
myself and Steve will review it, and then we can send everything to Brad for approval. Anything above $1,000, Brad has to approve.
Okay, so this will be reviewed, basically reviewed in-house.
Correct.
Okay, thank you for the
Commissioner Wilson?
clarification.
Didn't you say in our meeting that these write-offs are coming like after about 10 years?
Some are. Some of them fall into the 6-year category, some fall into 10, some fall into 20. If we have a judgment, we can renew it for an additional 10. So they're all across the board depending upon statute.
It's kind of though when we've exhausted all means to get the money, then we can write them off.
Yeah, exactly. We're spending more trying to collect something that we know is just not gonna happen.
Or a person's circumstances change such that they're no longer
Yep.
required to repay the fees.
Thank you.
And this will be coming back every year because the state auditors asked us to do that, or should we say, told us to do that. So every year we have to renew and approve this debt management policy.
Very good.
Mr. Chair?
Commissioner Jelinski?
It probably doesn't hurt, because in the topic that we're talking about, it's kind of a changing thing. At least, we've talked about this before. Today's not the first day. Last week wasn't the first day. This is kind of a changing thing, so I don't know that it necessarily hurts anybody to just take a look at it one more time and say, you know what, everything's the same, end of story, or light bulb went on and there is something that can be redone, so.
Yes, I agree, and that is what our intention is, so that we can make improvements if we find places that need it.
Very good.
Any further discussion? All in favor, say aye.
Aye.
Opposed? Motion carried.
Thank you.
Thank you, Bonnie.
Thank you, Bonnie.
Thank you.
Next
All right.
before us, Public Health, Brad.
Yes, thank you, commissioners. So we are approving all of the 20 intoxicating liquor licenses, or renewing them, along with 4 3-2 liquor renewals. I can't remember if they're on the same RBA or.
Yep.
Yep, so
It looks like
I'm
it.
looking at
Yes.
Mary's email, so.
Gentlemen?
I'll make a motion, Mr. Chair.
Second.
Motion made by Commissioner Jelinski, second by Commissioner Wilson. Any discussion? All in favor?
Aye.
Opposed? Motion carried.
And then I think there's one more. Yes, 2 seasonal establishment renewal license for 37 acres and a new establishment license for Woodchuck LLC.
Commissioners?
So moved.
Yeah, I'll second, yeah.
Commissioner made by Commissioner Jelinski, second by Commissioner Wilson. Any discussion? All in favor?
Aye.
Opposed? Motion carried. That's it.
That's all I have. Thank you.
Thank you, Brad.
Thanks, Brad.
Next on the agenda, Auditor Treasurer Chelsea.
I was waiting for that guy to make a motion.
It's I figured, but.
Good morning.
Morning, Chelsea.
Today I have before you a fireworks permit application. I'm requesting approval for the application for Paul Gopinski, the supervising operator. This is for a wedding on July 11th that will be held at the barn at Stony Hills in Cushing Township. Both the sheriff and the Randall fire chief have been notified and approved, and the required insurance has been obtained in the office.
What is the wish of the board?
Make a motion?
Motion made by Commissioner Wilson. Second by Commissioner Blaine. Any discussion? All in favor?
Aye.
Opposed? Motion carried.
Next on the agenda, I have the May 31st, 2020 cash report. This is a report that you see on a monthly basis. It just shows where we're at currently for the prior month, and then again, last year's totals amounts. I always kind of like to give an update of just where we're at. And last year at this time, the market rates for investments, I know this is not an investment worksheet, but just an update. The market rates last year for a 1-year CD at this time were around 2 and 2.5%, and currently they're at 0.60%, so just a little over 0.5% for the market rates. So different times we are in, but we are doing well for where we're at.
Any questions on that? All right.
And then I have next, request for board warrants.
Motion to pay all the bills.
Motion made by Commissioner Wincher.
Second.
Second by Commissioner Blaine to pay the bills. Any discussion? So, gentlemen, it's a roll call. Commissioner Jelinski?
Aye.
Commissioner Blaine?
Aye.
Commissioner Wilson?
Aye.
Myself, aye. Commissioner Wincher?
Aye.
Bills are paid.
Thank
Thank
you.
you.
Last but not least, I just want to add, just a reminder that early voting starts this Friday for the August primary election.
Good. Thank
Thank
you.
you.
Thank you, Chelsea.
Next on the agenda, Public Works.
Good morning, Steve.
Morning, Steve.
Morning, Steve.
Morning, Steve.
Have a number of resolutions for your consideration for completion of projects that the department has been working on. Completions from last year of carryover work, and then some work also that we've already finished for this season. The first resolution is for County Project 049-239-018 in Commissioner Wilson's district. It was a 1 mile of 370th between CASA 38 and County Road 251 that was reconstructed under a contract with Marvin Treader Incorporated. So our recommendation is approval.
I'll make a motion on that.
Motion made by Commissioner Wilson,
Second.
second by Commissioner Jelinski. Any discussion?
Mr. Chairman, I would just like to state that, you know, this is one of the collaborative projects that we had with Pierce Township. It was a good project in that the township, it fit our system, high volumes, much higher than what you'd expect on the township system. The township took on the work for acquiring the right-of-way and paid for the right-of-way. They also had skin in the games. They contributed towards the construction of the project. So I think it improved our transportation system. All parties benefited from it. And so from that perspective, it was a very good project. It carried over here because of the wet conditions last fall, but it's completed now and a good improvement.
It is well used.
Yeah.
Yeah, thank you.
Yes.
Any other discussion? This will be a roll call. Commissioner Blaine?
Aye.
Commissioner Wilson?
Aye.
Myself, aye. Commissioner Wincher?
Aye.
And Commissioner Jelinski?
Aye.
Motion carried.
The next request for board action is for 2 projects that were combined into one contract. This is for the extension at the airport where we extended County Road 257 from Airport Road out to 160th Avenue. And then we also included in this project the resurfacing of a segment from the overpass bridge of Highway 10 to Airport Road. It was a Knife River contract, and we're recommending
I'll
approval.
make that motion for more discussion, Mr. Chair.
Motion by Commissioner Winter,
Second.
second by Commissioner Jelinski. For further discussion, any discussion?
Mr. Chair, yeah, and I hope Steve agrees with me on this one. This was something that was in my wheelhouse for a few years. I mean, this was brought up to me years ago about, I call it the airport road, now it's County Road 257. The work that was done, that we worked with the city of Little Falls, the township of Little Falls, and including Morrison County, we all got together to get this done, because this road was kind of, it needed some help. And it was a township road at the time, and again, I hope Steve agrees with me. This gives us better access to the hospital. I think it gives us better access from the people from Little Falls, possibly going to the landfill, the airport road. This was just a great project that all three of the entities got together and got this done. And I think by what I'm reading here, or if it was there, we also got a huge grant. So it's not just county monies going to this road to make it happen. We got grant money, and I think it was, Steve, was close to $1 million, if you can agree with me or disagree with me on that.
A little bit over $750,000 in local road improvement funds went for the reconstructed piece of this. So, yeah, it was, again, a collaborative effort that made a good improvement to our transportation system.
Any other discussion? This will be a roll call. Commissioner Wilson?
Aye.
Myself, aye. Commissioner Winter?
Aye.
Commissioner Jelinski?
Aye.
Commissioner Blaine?
Aye.
Motion carried.
That's for both projects, correct?
That is for both projects, yep.
Thank you. Mr. Chairman, the next RBA is for final payment on work under contract with Marvin Treader Incorporated. It was the replacement of centerline culverts on County State Aid Highway 8 in Commissioner Wilson's district, from Trunk Highway 27 to our County State Aid Highway 51. And then also there were 2 qualifying bridges on County State Aid Highway 34 that were replaced under this contract. The one that was in the resurfacing project for this year was completed last year. The one down at Gutwell's Corner was finished this spring early. We'd recommend approval.
I'll make a motion on that.
Motion made by Commissioner Wilson,
Second.
second by Commissioner Blaine. Any discussion? This will be a roll call. Myself, aye. Commissioner Winter?
Aye.
Commissioner Jelinski?
Aye.
Commissioner Blaine?
Aye.
Commissioner Wilson?
Aye.
Aye. Motion carried.
Thank you, Mr. Chairman. Mr. Chairman, members of the board, RBA number 4 is for work that was let early this spring. It was awarded to Knife River Corporation. It was the mill resurfacing and repaving of County State Aid Highway 34, along with the installation of sinusoidal and improved pavement markings. This one was a little bit different than what Commissioner Wilson and I had talked about previously. The reason for it is both of them were funded federally, and because of that, we tied them together where normally the sinusoidal and the restriping would take place the following year. But because of the work that goes into a federal project, it's a better approach in this situation to tie them together with all the documentation and work that goes through to approve those, or get those projects approved. So Knife River's completed all of this work, and it's our recommendation that the board would approve this.
I'll move on this, Mr. Chair.
Motion-
Second.
Motion made by Commissioner Jelinski, second by Commissioner Winter. Any discussion?
Good piece of road. Been on that road probably 3 times in the last 3 weeks, and
Turned out pretty decent.
Good work out there, Steve. It's nice to have that piece done.
I'd like to say that on all the roads you've done, they're all very nice, so it's really helped our areas a lot.
Any further discussion? This will be a roll call. Commissioner Winter?
Aye.
Commissioner Jelinski?
Aye.
Commissioner Blaine?
Aye.
Commissioner Wilson?
Aye.
Myself, aye. Motion carried.
RBA number 5 is again, a project that we took on with Benton County and Buckman Township. And it was handled and administered by Benton County, and so that's where our final payment would go to for the reconstruction of a small segment of what is now our County Road 286 our recommendation is for approval. That's in Commissioner Wilson's district.
I'll make that motion.
Motion made by Commissioner Wilson,
I'll second.
second by Commissioner Winter. Any discussion?
Yes, Mr. Chair, I just think there's a lot of road work going on in Commissioner Wilson's district.
It's bordering yours.
I think so too. That's what I was thinking. Any further discussion? It's a roll call. Commissioner Jelinski?
Aye.
Commissioner Blaine? Commissioner Wilson?
Aye.
Commissioner Lemire? Aye. Commissioner Winter?
Aye.
Motion carried.
Thank you, Mr. Chairman. Mr. Chairman, members of the board, then the final is a request for a 2020 solid waste hauler's license to Diversified Enterprises doing business as Vanderpool Disposal. They are serving kind of the southeast part of the county down in that area, coming into our county up from Benton and Mille Lacs. So we'd recommend that the board would approve that license.
So moved.
Motion by Commissioner Winter,
Second?
second by Commissioner Wilson. Any discussion? All in favor?
Aye.
Opposed? Motion carried. Thank you, Steve.
That's all I have, Mr. Chairman.
Thanks, Steve.
Thanks, Steve.
Thanks.
Next on the agenda is construction update. Mr. Philippi?
Randy, my area is twice as big as yours.
Less people.
Yeah, I know.
Yeah, exactly.
I can put up with 2 roads, but 3, now you're.
Good
morning.
Morning, Mike.
Mike?
Morning. I just passed out updated budget. This really hasn't changed at all since we met as a building committee and looked at it. So I don't know if there's any additional questions from that day at all or on the budget, so.
Any questions for Mike? Everything moving along?
Yeah, upstairs, we're finishing the taping this week. We're gonna start painting next week up in the sheriff's office. We've got ceiling scheduled to start on the 6th and then casework on the 13th to go in, so, and then start flooring at the end of the month, so.
Great.
And then at the Public Safety Annex, we're installing the mechanical and electrical, below grade stuff right now, trench drains, undergrade, or below grade electrical. And then next week we'll start fine grading for the concrete over there.
Cool.
Any questions? Thanks, Mike. Thanks for the
Thank
update.
Thank you, Mike.
Thank you.
In building projects, it looks like they're tiring the parking lot today too, huh? Or is that-
They're getting very close, yeah. I think they poured all of the sidewalks yesterday, finished that up. And I know that was the next step to put that first layer on.
Yeah.
Well, there you go.
It'll be paid Thursday morning?
What is Tay? Oh, so close.
No.
It looks nice with that entryway. I
Yeah,
mean,
it
that's
does.
gonna be such a
Real
big
nice.
It is.
difference for this.
came up with that idea is
I was trying to think.
Thank you,
Thanks, Deb.
Commissioner Blaine, for that
Here
insight.
we go. Thank you.
This ad brought to you by.
No one else thought of that, so I appreciate
You
you
got
doing
that on
that.
record? That was your idea?
This ad brought to you by.
Administrators report?
All right, thank you, Mr. Chair. That was getting a little out of
Yeah, I had to
control
get-
there.
Back into contact.
I don't have any action items. I was gonna provide the update about the parking lot, but we've done that already. There's one item. We have guests here today. Amy didn't have an agenda item, but has a new face we thought we would introduce and say hello to. Morning.
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 Yes.
Is this where we get to meet a new employee?
Yep.
This is the time. You can.
Aren't you glad you came today?
Good morning, everybody.
Good morning.
I just wanted to introduce you to our new feedlot officer. This is Zachary Skira, and he started yesterday. So we are getting him up to speed and trained and all of that. So he'll be the new face of the feedlot program, and you'll see him here and there now when it comes to feedlot matters before the board and the planning commission.
Welcome.
Yeah, thank you.
Yeah.
Mr. Chair, may I ask you a personal question?
Absolutely.
Where do you live?
I live in Holdingford right now.
And you're
Did you hear what he
moving,
said?
and you're
Right
moving to
now.
Morrison County when?
We'll see.
Welcome aboard.
Yeah, thank you.
Amy, I want to thank you for the meeting last night. It
Oh.
went off, I thought
I
it
thought it
was
went very
great
well.
on their end.
Did.
Yes.
Yeah,
They're
just
getting
when we're
better.
getting that down, we have to switch.
Well, they're getting better all the time, and I'm really impressed with the people on both boards.
We do have fantastic
We
members.
do.
Yeah. Good. I thought it went well too, and I thought we had some good discussion,
Yep.
so.
Yeah,
Yeah.
the discussion on the last topic at the, of the meeting there, I thought was very good.
Well, and I'm glad most of you were tuned in to hear that
Yep.
too, because I think it's helpful for you to hear that. And it gives us more to talk about and research, so, yeah. And I'll do that with the Board of Adjustment as well, so.
So
Okay.
getting back to the task at hand, if I may, Mr.
Yeah.
Chair,
Yes.
what have you done, Zachary?
What have I done? So
What haven't you,
hasn't he done?
what haven't you done?
yeah, I've done it all. No,
Tell us a little bit about yourself.
yeah. So I went to school in Brainerd for 2 years. Got my associates in natural resources, and then I spent 2 years in Crookston at the University of Minnesota. Got my bachelor's. After that, I went to work for Knife River for the last 4 years or so. And yeah, I grew up on outside in the country on my uncle's farm. Basically lived right across the road, so I spent pretty much my whole childhood there. So yeah, that's kind of where I'm at.
Excellent, excellent.
So I think as during Steve's report, he was perking up a little bit because he has some.
Some stake into the Knife River stuff.
Yeah.
Yeah.
They do a lot around here.
So, yeah.
Yeah. Well, welcome aboard.
Yeah, thank you.
You're welcome.
Nice to meet you all.
Yeah.
Nice meeting
Amy,
you.
thank you for bringing the new employees.
Yes, you're very welcome. We're excited to have him.
Yeah.
So.
Good.
That's
All
good.
right. Have a good day.
All right.
thank you.
Thank you.
Have a good
Okay,
day.
thank you.
Thanks, Zach.
Oh, and she found those results.
What were they? I was wondering what it was.
Thank you, Siri.
Anything else, Deb?
No,
All right, Tabitha, what days do you want?
We have 3 weeks this time around. We're
I'm not
looking
ready,
at
so.
June 28th, all the way through July 18th, which would be the week after.
To July what,
18th. Commissioner Winter, would you like to start?
Sure. So what was the start date again?
June 28th.
June 28th, okay. On Tuesday, we have a planning session at 8:30. On the 3rd of July, I believe we're gonna have a Public Works meeting, and that's gonna be at Public Works, or will that be We're canceling that one.
Canceled.
All right.
Which one was that?
The Public Works meeting for Friday, the 3rd of July. So we will not have a Public Works meeting in July, correct? Okay. Tuesday, we are open at this time, it's supposed to be, could be a planning session at 8:30, but I think that's on the 7th. We don't have a board meeting, correct?
No.
I don't believe we have anything. I think that was a
Right.
free week.
Okay, so that'll be a free week, just wanted to bring that up.
Meeting on the 7th?
I don't, I can confirm that when Deb comes in, but I don't think so. I don't think.
But we
unless
do
need
have
to
Board of
a planning,
Adjustments.
I don't think so.
That's on Tuesday night.
Hooray.
but not
Tuesday.
But not at
Yeah,
Tuesday.
hip
morning.
hip.
And then at Tuesday at 7 o'clock, again, I don't know if it's gonna be via web or whatever, is a Board of Adjustments at 7 o'clock,
On the 7th?
the 7th.
7th, scheduled for WebEx.
Right. And then I have a local work group meeting from 10 to noon, a call-in. I'd have to, let me get some more information on Wednesday, the 8th. I'm not for sure what I have down there for that. The 14th, I have a board meeting at 9 o'clock. And we're going all the way to the 18th. Well, then that would fill my calendar at this time.
Do you have TCC on the 16th?
Not yet this time. I don't have it down, so I would give that to you.
Commissioner Jelinski?
On the 2nd of July at 10 o'clock in the morning, I have a State Emergency Communications Board Legislative Committee phone conference. That's at 10 o'clock in the morning. On the 8th, I believe scheduled at 8:30 in the morning is a department head meeting.
Yep.
On the 9th at 6 o'clock, I have a trails meeting scheduled. They have not been meeting as of late. There hasn't been a lot going on with the legislature. Don't know where it's scheduled to be, so I simply have to be determined. On the 10th at 10 o'clock in the morning is the Central Minnesota Emergency Services Board RAC meeting, scheduled for the Alexandria Fire Hall. On the 14th, after our county board meeting, we have Connect with Your Commissioner. So I don't know if there's necessarily a time, but it's after the board meeting.
It is, we'll do, that's the new employee kind of orientation part that we're doing. Mhm.
On the 15th at 5 PM, I have a Hands of Hope meeting. That's actually scheduled for the first time since COVID here in the boardroom. I don't know if that's what's gonna happen or if it's gonna be via WebEx, but as of this second, it's the boardroom. On the 16th at 10 o'clock in the morning, I have a Central Minnesota Emergency Services Board Owners and Operators meeting. And I believe that's now gonna be on Teams versus WebEx. And at 7 o'clock that same evening, I have a Egg Society meeting scheduled, and that's at the fairgrounds. Mr. Chair, I believe that's all I have.
Commissioner Blaine?
The, on my calendar, on the 10th, I have Public Works, but that we must have thought about moving it from the 3rd to the 10th, and then now, and now we've canceled that, correct?
I didn't have anything unless the board would like.
No, that's fine.
Yeah.
So the 10th one is gone.
Okay, thank you. Otherwise, the only other thing I have is, the 15th is Tax Freedom Day, so for all the conservatives here.
Thank you.
Commissioner Wilson?
On the 16th, I've got airport, and I think that's all that I have different.
I have, on the 30th, HRA, 1 o'clock. And, oh, wait. Oh, that's right. And then the 13th, Yellow Ribbon.
You know where that's gonna be?
It's probably gonna be Zoom. They don't tell me until like the day before where it's at or
Okay.
how. And that's it? Gentlemen, got anything else? Deb?
No.
Tabitha?
Move to adjourn?
Yes, Commissioner, move to adjourn by Commissioner Blaine.
Second.
Second by Commissioner Jelinski. Any discussion? All in favor?
Aye.
Opposed? Motion carried. Meeting adjourned.